when the woman gets pregnant naturally, in the early stages of the pregnancy, she's completely unaware of that, usually, and she remains active, keeps performing all the acts of her everyday life as she's used to, and still the pregnancy continues. Therefore, it shouldn't be necessary to recommend any special regimens or regimes after the embryo transfer. However, we try to be extra careful, so we do usually recommend after the embryo transfer a sort of protected period for about 7 days, where the patient should refrain from heavy physical exercise, meaning heavy lifting, sports, and sexual intercourse. Otherwise, medications are taken as needed, but the patient can stay normally active, including normal physical activity. Of course, the level of the physical restraint is individual, and what's normal for somebody may be a lot for somebody else. So an individual approach is a very good idea. There are studies that show that the length of bed rest following the embryo transfer has no effect on the outcome of the IVF cycle, and therefore bed rest is not recommended. Basically, it's an active regime with a normal diet. I always say to my patients, anything that makes you happy and content, that's recommended. Only stay away from the extremes, be it physical exercise or psychological stress.